Hello, beautiful people, and welcome to another episode of Conquering Cancer and Beyond. Today, I have the pleasure of interviewing Creasy, who is an ovarian cancer survivor. Kristen has an apparel brand called Swearing Off Cancer, which she started during her cancer treatments. She is a certified yoga and Yoga Nidra teacher, and she teaches yoga at the Body, Mind, and Spirit program at Virginia G. Piper Cancer Center. One awesome fact about her is that she was selected as on the rise for 100 plus women you should know and do business with on behalf No Phoenix book of 2019. Well, thanks, Kristen, for coming and having this interview with me. Let's start with telling everyone what kind of cancer you were diagnosed with, what age you were, and what kind of treatment you went through.
Okay, I had ovarian cancer, and I was at age 35. It was found by chance because I had opted to have a partial hysterectomy because of suffering from endometriosis for so long, which is when the tissues inside of your reproductive system start attaching to stuff. So everything was fused together. My ovaries were fused to my uterus, and my uterus was fused to my abdominal wall. So yeah, it was crazy. And then they just happened to find stage 1 ovarian cancer in my right ovary that was removed.
Okay. So you just had your right ovary removed, or did you get the full?
Only the right, because the plan was with my gynecologist that we would ease me into menopause, and so we kept the left ovary, so I'd still be producing some estrogen.
So what went through your mind when you heard those dreaded words that you have cancer? Like, what was your reaction? How did you deal with that emotion?
Oh my goodness, we almost didn't have a reaction, and I kind of felt just kind of okay. It was a really weird feeling. I felt kind of calm, like it's okay, all right. Yeah, it was actually my husband that had a harder time with it than I did. We didn't talk about it for the first 3 days, though.
Really?
Yes, we didn't talk about it, and then we just were sitting in bed, and then at one point in time we just looked at each other and we both started crying together. And then after we had that release and that emotion, we're like, okay, now we got this. And then we were able, because we're very sarcastic and joke a lot, so we just kind of like made light of the situation as best we could. That was our way of dealing with it.
So what happened with, did you guys want to have kids, and did you already have kids? Like, so how did that go for you?
Yeah, we had already decided in our late 20s that we weren't going to have kids.
Okay.
And so that's why having the partial hysterectomy wasn't a big deal to us.
Okay. So yeah, because I could just imagine that would have been more of an emotional, but I think that kind of helped for you to move forward with this.
Right.
So how did you share the news with your family and friends? Because I'm just hearing your story about how you and your husband dealt with it, didn't talk about it and then release. It must have been so hard to share that with your family and your friends.
While I felt okay about everything, I was like, okay, everything's gonna be okay. I couldn't talk about it yet because like you said, having that, just like getting the words out, I think.
Yeah.
And so my husband made the phone calls immediately after we found out and told our immediate family. And then he had a hard time talking about it too. So he was like, tell our brothers and our sisters and tell the rest of the family. This is as far as we can make it.
Yeah.
So yeah, but I mean, it took me after we had that initial reaction and release, then we were perfectly fine talking about it.
Yeah, I think the biggest thing is just accepting it, and then figuring out a plan of action to, okay, it's not the end of the world. I know it can be treated, and what do we need to do to move forward with this?
Yeah, we had just moved to the Phoenix area from Illinois, so we'd only been here 6 months. And I had seen the same gynecologist who I knew trusted in Illinois, so we went back there. I had my surgery there.
Okay.
She, it was crazy because while being there, it was like a comforting, and it was we hadn't sold our house yet, luckily, although that was stressful at the time. It was good to not have sold it. And so we had this place that we could just be. We had built the house. It was very important to us, and just to have that comforting place and to be where family could get to me. We were an hour away from all of our family and friends, and so I think it was good that it happened in that way.
Yeah.
But then also we had to do all the research of where to go because my doctor didn't know any of the doctors here.
Oh, so you had your surgery there, but then did you have chemo?
Because we were coming back here, yes.
Okay.
And so the Mayo Clinic was what popped in her head, right? Well, there's a Mayo Clinic there.
Yeah.
Well, like you said, what you can do is, the only thing we have in our control is to do our research and figure out the best plan.
Yeah.
And I did my research and I found out that wasn't the best place for me to go. That they aren't known for their gynecological oncologists. And so I did my research and I found Dr. Janicek here, who's a part of Arizona Oncology, and he is one of the top in the nation. And so I was able to get into him. So that's kind of how I filled that time in trying to doing the things that you can do.
Yeah. Absolutely.
And so then she referred me to him, and I had all of my treatments, 6 months of chemo treatments here in Arizona. So back home.
Yeah. So what was the one thing or your mantra that got you through this journey? Because like having the surgery is one thing, and then going through the chemo for the longest time is heart-wrenching, and it's the worst thing. So, and there's always something that we're holding on to that we know we have to get through this somehow or the other. So what was the thing for you that got you through?
The thing that got me through was my apparel brand that I started during treatments. And I actually started with sketches because, like you said, chemo is so incredibly hard. And everybody actually responds to it differently. But for me, I would be in bed for 3 weeks out of the 4. And, as soon as you start feeling better,
it's
then
time to go back
all over again.
Yeah.
And so it was, that was really hard. And not everybody... Most people are afraid of the word cancer. Yes. It freaks them out. I've come across even people who said that there are people in their lives that wouldn't even let them use the word cancer. They had to call it the C word. It's just very isolating.
Absolutely.
And then you also find out a lot about all of the people in your life, relationships. It's like it shines a bright light on everything in your life. And so there's things that you recognize and realize, and so there's just a lot of emotional stuff that I don't think people realize.
Absolutely.
They just think about you going through the treatments, and then once you're cancer free, you're done. It's like, no, this was life changing.
Yes, absolutely.
And so doing my sketches and letting that out, and recognizing that I wasn't the only person that probably felt this way. And so just also knowing how fortunate I was to find the ovarian cancer when we found it, because that's incredibly rare. So all that stuff just kind of kept me going, recognizing how fortunate I was. I remember sitting in the chemo room with all of the women, and I was the youngest by far in the group of women. And I remember the women always saying to me that they felt so terrible. I was so young to be having cancer. What they didn't know is I felt so terrible because I knew that I had a better prognosis than they did.
Yeah.
So it was just kind of one of those...
Yeah, it really is. I think it just puts our life into perspective as well, And it's amazing that you just shared this story, because you're sitting in the room, you're all doing the same thing, but what's going in each and everyone's mind is totally different. And that's why this world is so amazing, because we all look at the same thing in a different way. It's really our experiences and what we've been through in life that kind of give us that outlook. So I'm assuming you did the Red Devil first, the 4 treatments, and then... So
mine, the reason why I had 6 months is he altered them for me. So I didn't have to do the carbo and Taxol combo, which the Taxol is the one that you have, as you lose your hair, has a lot of the permanent side effects like neuropathy. He worked with me and said, well, we can do 3 months of the combo, or we can do 6 months of just the carbo. So I had to do just the carbo for 6 months. That was the arrangement. That because I am normally not a person to put chemicals in my body. I'm very organic and I don't take anything. And so he recognized that this was difficult for me to do. And so he worked with me. Because of the type of finding it at stage 1, the odds that we got it all out in surgery, all of that stuff.
Okay.
So, yeah.
And are you on hormone blockers?
No. I've opted not to take any type of hormone blockers, hormones, because mine was estrogen-based cancer. And so I have nothing that's producing. So I ended up having a total radical hysterectomy. So I ended up going in and taking the last ovary and even the tissue around the uterus and everything. So it's, like I say, it's hollow in there now.
Yeah.
So I'm not producing any estrogen, which means I'm aging faster.
I'm with you, sister. So I had my right breast removed, and then I got my ovary and my uterus removed as well. But because I still have my left breast, they put me on hormone blockers.
Okay.
So I'm way ahead of you. Yeah. So I can feel your pain.
Yeah.
So let's talk a little bit about how your life was before cancer, and how did cancer change your life? What is it, physically, emotionally, mentally, like what has been the biggest change for you, you feel, with this cancer journey?
The biggest change for me is my perspective. Like, you can't help but your whole entire perspective just flip. I feel like now that I'm 39, I feel like I have the knowledge that a 70-year-old has, right? So I have the benefit of going through this life-changing scenario that has taught me so much more quickly, I feel like, than would have happened. Yeah. So just being able to have more self-awareness, which then also makes me more empathetic and caring to others and more accepting to others. Sure. And I was always like very sensitive to that, but just realizing there's so much more depth to people than what you realized before. Yeah. So basically I just feel a little bit more, I guess maybe enlightened is the word.
Sure.
And more at peace at things, and making a point to constantly grow and learn and be there for others and then help them too. Yeah, so I do more for others too than I did before.
So do you think, you're doing it a lot more than you used to?
More than I used to, and getting more out, because I always did for the people in my circle, right? Yeah. But now I get outside of my circle, and I go and volunteer, like at the hospital, and then I do the work with the Virginia Piper Cancer Center, and just all of these things I wouldn't normally do. I wouldn't normally be getting up and speaking in front of 850 people like we're going to do.
Yeah. So that's going to be so exciting that I get to share the stage with you, and it's going to be amazing. Yeah. And your story is amazing. And so the shirt that you're wearing is one of the shirts is what you designed. Yeah, I love that.
This is the logo.
Wow.
Yeah.
So this is what you do now.
This is what I do now. So this is this is a part of what I do now. So I have the apparel line, which I started during my treatments. I was doing all of that prep work, and then I also do yoga. So I teach restorative and gentle flow, and then I also give Yoga Nidra sessions. I work with cancer patients, like I said, through the Virginia Piper Cancer Center. Yeah. And then I work with my charities, doing charity events and donating back to them, percentage of the sales, and so it's all that.
So do you feel like you finally found your purpose? Or you still feel like there's a lot more that you have to do?
Yeah, that is something that you kind of struggle with. Like, I know I'm where I'm supposed to be, doing what I'm supposed to be doing at this very point in time, but I don't know that if I could say, like, this is my purpose. I don't know if I'll get there, but I just try and do as much as I can.
I've interviewed quite a few ladies, and from what I'm seeing is like whenever I talk to anyone who's been through this journey, they're always doing something that I feel like they've wanted to do, but something was stopping them. And then once you get this big shake in your life and you realize, you know what? No, like what I was doing before was not me, but now I'm doing what I am supposed to do.
Right.
And I just feel it wakes us up.
Yeah.
It's like, hey, wake up and do what you are meant to do. Because I feel when you do that, it comes from within, and the returns are just amazing. And we go through these experiences of, the surgery and the chemo, and you're way ahead of your time, and you're able to talk from that experience, and I think that just makes you a lot more grander, if you will, and informed of where you're coming from.
Right. And I think too, it's also a matter of you have this something that can take complete control of your life, and so the only thing that you can control is the way you react to it.
Absolutely.
And then what do you do?
And that's the biggest thing, is what I talk about, and the reason why I'm doing this is because I feel like when we're going through our treatments, we're going through chemo, we're going through our doctors, we're going to see them every week. For 6 months you went for your treatment every 3 weeks or 4 weeks. They were part of your life, and then all of a sudden they're like, okay, we will see you in 6 months, bye-bye. And you're like, wait, what? I'm not going to be coming back here?
What am I supposed to do
now? What am I supposed to do now? And that's when I feel like we need to figure out how to live again, because what we used to know before is not going to work for us anymore, because now we've gone through this life-changing event, and now we need to figure out our new life, our new normal. So that's where I feel like people are like, okay, she's done with her treatments and cancer's done, so it's good, and everyone's on their way thinking life will be back normal, but it's not. I think that's when it starts for us, trying to now figure out how to live again, and what works for us now and what doesn't. So what changes have you made in your life after being labeled that survivor, and the doctors are like, okay, we'll see you in 6 months and a year, and you're like, what did you do? How did you change your life?
You're so right, because you are just like pushed out on there on your own, and your body is completely different. It's like it's no longer your body. And so what I do is just constantly researching and trying to find different ways of dealing with certain symptoms that I have. Like I have hot flashes now because I'm in menopause, right? And then I'll have mood swings, or you have anxiety, and there's just a lot of different things that you don't realize are going to come. They don't give you the warning. And so you're like, what in the world? And then even our digestive systems are different. The way we process foods, the way our body reacts to things that maybe we've used and done forever, and then it's
not the same.
It's not the same. It doesn't work. And I can't do strenuous exercise anymore. My body can't handle that. And so it's a matter of adapting and researching. That's really what led me into more of the yoga world, and coming up with a different approach that's actually for cancer survivors or patients that are going through that. So I'm constantly using myself as my own guinea pig and seeing what works for me, and adjusting the things that I know that my body doesn't like anymore.
So what's the biggest change that you think you've made for yourself from before and after? Like, what's the one big thing that you...
Meditation. I would say, so being very self-aware, knowing what is going to affect my body in a negative way. So if stress is horrible for our bodies,
absolutely,
and especially if you've had cancer, it's something we have to keep track of. So if I feel myself getting ready to respond because something has happened, knowing how to deal with that and handle that to make sure I can bring my stress levels back down, because my body will react in so many different ways, from being sore and tight, or I put on weight. You literally are absorbing the stress. Now it just can't deal with it. And so meditation and learning how to just, and actually if I say I have a day where I can't get a walk in, I can't get my yoga routine in, my priority first is meditation. First, I want to make sure I have time for that, and then the other stuff is gravy.
I'm exactly like you. If I don't meditate, my day doesn't go right, because I just feel like when you meditate, you're connecting with yourself, and you know what your body needs at that time. So for me, that's what I do first thing in the morning. Is I do my meditation. It just connects me with myself, and I kind of know where my body is going. I feel more in control. And if I don't, it messes my day up. It really does.
Because it is a way of just letting you be able to react when things pop up throughout the day.
Absolutely. It's crazy how our bodies just are not the same. From even being tired.
Oh.
You know, there were days after I got done with my chemo, my parents were here through the chemo treatment. They left, and my husband travels back and forth. He works in Africa. So he left as well, and then I was here left with my girls, and it was so hard for me. Like, I would have to go pick them up from school, and I'd come home and I'd just go sit on the couch because I just couldn't keep up with it. And there were times where I'd just tell, and my older ones at least a little independent, I was like, can you make your sister a sandwich, because I cannot get off of the couch. It's really hard.
How long did it take you to recoup after being done with treatments?
I think I'm still recouping.
Yeah, it took me more than a year before I could actually like hike.
Yeah. It took me at least definitely a year before I could even think of exercising. I was still doing the yoga. I was doing my Pilates as much as I could. But like to go in now, I used to do interval training all the time, and now I can't. Nothing would stop me. Now it takes a lot more for me to keep up.
Yeah.
You know, and but I just keep telling myself it's okay.
Yeah, that's the thing, is accepting like this is my new body, and it's gonna be okay, and it's gonna keep changing.
It will.
And so it just learning that I think that's probably the hardest part of
I think
recognizing it doesn't react the same. You can't do some of the same things.
Yeah. And I feel like someone who hasn't been through it cannot relate.
No,
Yeah,
I feel
it's
like
very hard, and I appreciate, people asking, talking, but I feel like you cannot relate to it because you've not been through that.
Yeah.
It's a very hard thing to get back to.
Yeah. That's one of those things when they say to you, I understand. No. I realize you're trying to understand, but I don't think you understand.
No. And each one of us react differently. You know, all of everyone's bodies are different. So depending on what we were doing before, and what we went through, and then trying to figure out, okay, what can I do now?
Yeah,
it takes a while.
It does. It really does. And just accepting it.
I think that's the biggest thing.
Yeah, you have to just forget about what it was and let that go,
and just be a new you, and just accept it, and just give your body the time it needs. Right. Wow. So, Kristen, what's the one thing you'd like to tell anyone who's unfortunately starting this journey? What would you like to tell them?
Oh, my goodness.
What would be your advice, or one thing that they should learn from your experience?
That there is life after diagnosis.
Yeah.
And it's how we choose to respond to what's happening in our lives.
Absolutely.
Because we don't have control over everything, but we do have control over the way that we
react to it. Absolutely. And that's the reason why I started this channel, because any one of you can reach out to any one of us, because Kristen's story might resonate with you or someone else's, and we're here for you. This is a network of women who have been through this, and we just want to be there for all of you. So please reach out to us at any time. Thank you, Kristen.
Yeah, thank you.